Hello, welcome for today's presentation. We are on our episode 3 of the low back pain series. Episode 1, we looked at the prevalence of back pain. We looked at the role of imaging in management of back pain. And the denominator here is pain. So let's look at what pain is. One time I was working on a lady who had back pain, and I told her that pain in itself is a good thing to us as humans. And she didn't take it well, but then I realized it and I explained it to her, and she understood my point. So today, let's try to look at what pain is in relation to the low back. We all agree that most people go to hospital because of pain, especially in physiotherapy clinics. Most of the patients who come to us, they come because of pain. But the truth is, pain in itself is not bad to us. It is a way of our brain informing us that there is something wrong or something that could be wrong that we need to sort. Imagine what would happen if we could not feel pain. I think you'd just see somebody fall off and die without knowing that they have a problem. I think this way because of what used to happen to lepers. Back in the days, we used to have people suffering from leprosy, but thanks to our health systems, at least that is a problem that they have managed to fight. So these people who have leprosy or who had leprosy would have problems with sensations. They would not feel the affected parts, would not feel. So if a leper puts his foot on hot charcoal and is not looking at it, then you'll only find when he has burnt the foot. So pain is a way of helping us to know that there is something that is not right and that we need to do something about it to protect ourselves. So enough of the introduction. Let's start our presentation. Understanding pain in low back pain. It's not always about damage. Again, I'm Tibesi Gorabson, a physiotherapist based here in Uganda. And for the past 13 years, I've been working and serving the Ugandan population as a physiotherapist. So, uh, what is pain? And in simple terms, this is what I can say. Pain is an alarm by the brain to say that something is or may be wrong. It is the body's way of protecting you from danger or potential threat, and it is not always a sign of injury. Pain is produced by the brain. Though you may feel it in the low back, it is actually produced in the brain. So if you look at this image of somebody feeling pain around the low back, but again, the pain process is happening in the brain. Let's continue. How pain is produced. So, pain is produced via the following loop. There will be an input, that is your tissues where you're feeling pain. Actually, your tissues in that area are having nerves that send signals to the brain via the spinal cord, then to the brain. So, this information or signals are not pain themselves, it is what is going on. But our nerves are the messengers. So, they take the information to the spinal cord and then to the brain. So, that is the input. Then you have the transport, that is the nerves, spinal cord into the brain. Then the brain interprets the information received. So after interpreting the information received, the brain makes a decision. To look at this, it will look at this information and decide if the information received is dangerous or not. And if it is dangerous, then there will be an output, and the output will be the brain taking action. It can be pain production, the brain can produce pain, the brain can make you feel fatigued or weak, the brain can make you feel dizzy, demotivated. All those will be outputs. That is, it has made the decision that the information you have got is dangerous or is a potential threat, so it will react by creating something that makes you protect yourself. When you have pain, you won't be as active as somebody who is not feeling pain. When you're weak, you won't be as active. Your movements will be limited. And in this way, you are being protected. So why does the brain produce pain? Pain is the brain's way of saying something is or might be wrong. Let's slow down or stop. But the brain can sometimes overreact, like when there is no real danger and you find you're having pain. So think of this as the car alarm that goes off when a leaf falls on it. So there are some myths surrounding pain. So let's look at some of them. One of them is pain means damage. This is not entirely true, as per se. Some people have injury without pain. Then some people have pain even when the injury healed. When do people have injury without pain? Those of us who are from villages used to collect firewood. Then you find a piece of wood has entered your skin and you didn't feel it. But then when you're bathing or you have reached home, you realize there is a foreign body in your skin and you remove it. There is a clear an injury to the skin, but then there is no pain. It means the brain didn't perceive that as a threat. So it did not react by producing pain. Then some people have pain even when the injury healed, or even when there is no injury. You find somebody is having pain in a limb or in an arm that was cut off, maybe because of disease or because of an accident. The limb is not there, but the pain is there. And you're feeling it in that very part that was removed. I should avoid exercise. That is another myth. This is not true. When you have pain, especially relating to our low back pain, graded exercise that does not worsen your pain are important for your recovery. Hmm? Another myth is about around sitting. People always told with back pain that you always sit upright. That is not right. When you have back pain, find a sitting position that gives you comfort. Because upright position may not be what you need. You may sit upright and then you feel more pain. Your body is seeing this as a threat. So it is sending danger signals to the brain and the brain reacts by producing more pain. And then maybe you find when you bend forward and then there's no pain. So what would you do logically? Do you remain sitting upright and feel the pain, or you adjust the position for comfort? Mm. Another myth is that I need bed rest. Again, this bed rest does not help you recover from low back pain. Active rest is recommended, but again, you should work within the limits of the pain. Don't overexert exercise on your body. Do exercise that is within the pain limits. You can do them and you're not hurting so much. Exercise should not actually be causing you lots of pain, because that means it's increasing the threat perception. Pain is more than just physical. And here, what do I mean? There are an array of factors, biological, psychological, and social, that contribute to the pain experience. Mm. So, the biological factors, your age, the gender, the genetics, physiological reactions like inflammation, and tissue health when there is direct injury to the tissues. Age, again, if a kid is playing with his fellows and he falls down, and you as a parent is there and you're alarmed, and the kid will look at you. If the kid sees that you're scared, the kid will perceive danger. You know there's something terrible, the kid will react by crying. But if your kid falls during their games and you applaud, he will look at you, get up, and move on. So, the psychological factors, mental health, emotional health, beliefs, and expectations. So if you are worried about your pain problem, you are in so much worry, you're anxious, you don't know what is going on. Mm. Some people have beliefs that the moment you have back pain, you're finished. The back pain will never resolve. It will always come and go back, or even stay. Your expectations of whether you'll recover or not, they are important. Then social factors, interpersonal relationships, maybe at work, you have a terrible boss, you're having an issue with your back, and is the boss is also stressing you, your pain will definitely rev up. Mm. Social support. Social support. Find you already have a problem, you're having pain, but you don't get the right kind of support, maybe from your health workers, maybe from the people around you. This will increase your pain. You come to the hospital to talk to your physiotherapist or any other health worker, and maybe you come with an X-ray, looks at it and says, "Oh my God, this is the worst X-ray I've ever seen." How old are you? This is an X-ray of a 70-year-old when you are 20. You'll be scared. So the support there is not the right one. Mm. Then psychoeconomics, of course, with the right finances, you can be able to get the right kind of health care. So it plays a part in your recovery. But when you're having pain and then you don't have money to go to the hospital, it increases on your stress. So let's look at what we call the threat bucket. The threat bucket metaphor is something to explain the contributing factors to pain. Now, let's say our brain has a bucket, and this bucket has a tap on it, and there are inputs. These arrows you're seeing here, those are different inputs to the bucket to increase its volume, the volume of its contents. So when it reaches the level of the tap, then it will flow out. And what is coming out is pain, what is coming out is fatigue, it is weakness. So, which factors are the inputs to the threat bucket? Relationships. If you have relationship stress at home with your husband, with your boss, with who, that is already a threat registered. So the contents of your bucket are piling. Work stress, they are piling. Exercise, a lack of or excess of exercise can be a threat. You're experiencing pain and you're doing exercise that is increasing it, that is a threat. Or you are just sitting and sleeping, you're not active, that is a threat. Balance, your balance system that is coordinated by the ear and the brain. If you cannot balance well, maybe during movement, your nervous system, your brain will record that as a threat. So the contents of the bucket are increasing. Your education, what you know about your problem, what you know about the pain, how the pain is produced, like you're learning now, it can be a threat or it can be something that helps you to recover. If your education is poor, you think you're damaged, you think back pain does not recover, you think you should avoid exercise, so that is a threat. Movement patterns, the way you move, if not right, if the way you're moving is increasing your pain, it means your movement patterns are a threat to the brain. The brain is recording how you're moving as a threat to the structure. Sleep, a lack of sleep, you are sleeping 3 4 hours per night, that's not sufficient for you. So your body will be in a state of stress, and that is a threat. Visual skills, the way you're seeing, if your eyes cannot see properly, if you have visual problems, and sometimes you're seeing but they're just about the eye movements, then the way images are formed on your brain will be affected, and the brain will look at that as a threat. Nutrition, again, this is key. What you eat, if you're not having the right kind of nutrients and amounts of nutrients to your body, then the brain is going to record that as a threat. So when all of these pile up, of course, we are not forgetting the fact that yes, tissue injury can also be a threat. So when all those pile up and they increase to the level of the tap, then something small, you find like you're lifting a bucket and then you get back pain. But honestly, you have lifted the buckets for the last 30 years and you didn't have a problem. Why now? There is something else going on, and the bucket is just, yeah, you have reached the tipping point, the threshold, and then you are going to have pain. Key messages: pain is real, but it is not always about injury. And the brain uses pain to protect you. If you teach your brain safety, if you do the right things, you have the right kind of education, your right nutrition is fine, your eyes are working well, your balance is okay, your relationships are fine, psychosocial factors, biological factors, you're okay. Then, or if you start working on them towards being fine, then your pain should reduce. The brain will automatically start registering safety. It will reduce the pain. Conclusion: pain is produced by the brain and is aimed at keeping us safe. So we should use it as an ally and not the enemy. If we understand the pain and then use it to do exercise correctly, to feed well, to sleep well, we should have our pain reducing. And in so doing, we are solving the problem that is causing it in the first place. So if you have questions, you or your loved one has back pain, knee pain, stroke, or is a cancer survivor, contact Rajon Physiotherapy for individualized care. And contact us through our phone number 0789990058, or you can come to Wonder Hospital in Matuga. Our friendly and knowledgeable staff are available to assist you and provide you with information that you need. Thank you for your attention.